Hello there and welcome to Business Tuesday. Remember, this is a program where you learn everything as far as business is concerned. We talk about entrepreneurship and we talk about the startups and anything to do with business. And today we are having a very special show for you guys because we will be having two gentlemen on the show. Of course, in the first round, we'll be talking to Dr. Musa Nyandusi. And also in the second round, we'll be talking to Andrew Muruka. And I'm telling you, stay tuned because today we shall be talking about something a bit different, but it's something that really concerns your life. And by the end of the interview, we'll have learned a lot. Because maybe just to give you a brief, we will be talking about Directorate of Occupational Safety and Health Services. That is what Dr. Nyandusi will be taking us through. And now I take this opportunity to welcome him to the program. And before that, guys, my name is Maurice Owino and this is Lolwe TV. Welcome to the program. Hello, sir, and welcome to the program.
Thank you. Thank you very much for inviting me to this program.
Yes.
And thank you for giving us the opportunity to share our perspectives and what our institution and what we are doing and what the expectations are that we are trying to meet. My name, like Dr. Musa Nyandusi. I am currently serving at the Department of Labor in the Ministry of Labor and Social Protection, the Directorate of Occupational Safety and Health, as the Secretary responsible for Occupational Safety and Health Services. Now, the Directorate of Occupational Safety and Health Services is the government agency charged with the responsibility to ensure the safety and health of all workers, both in public and in private sector. We also have a dual role to administer work injury benefits. These are the compensations that is due to workers who get injured, disabled, or who may unfortunately die as a result of occupational injury as well as occupational diseases. To be able to effect these functions, we administer the Occupational Safety and Health Act as well as the Work Injury Benefits Act. The Occupational Safety and Health Act is the act that gives the basis for the programs and interventions that ensure the safety and health of all workers, while the Work Injury Benefits Act is the parliamentary act as well that ensures the compensation of workers who get injured, disabled, or unfortunately may die as a result of the occupations that I so mentioned. We also have the Occupational Safety and Health Policy. We are responsible for the implementation of the National Occupational Safety and Health Policy. Again, all that is geared towards ensuring a healthy worker in a safe work environment. A lot of people may remember us as the Factories Inspectorate. For those who enjoy literature, I think there's a book written called The Factory Inspector. The Factory Inspectorate is what morphed into what is the Directorate of Occupational Safety and Health. And the preceding legislation was the Factories and Other Places of Work Act. And you can see from the wording of the act then seemed to presuppose that injuries and diseases happen in the factory setting or in the manufacturing setting only. We know that work happens in all spheres, and occupational diseases and occupational injuries can happen in majority of, in all workplaces. Indeed, today, from statistics, the largest injuries we get are actually from the transport, the construction sector. So you can see how inadequate that legislation would have been to address the issues for workers who would be in this sector. So that's, in a nutshell, the Directorate, and of course, since 1951.
Yeah, actually, I was about to ask you, when was this thing started out? Because I can tell you for sure it's something that I really believe so many people probably are not aware of it, especially when you go to the village.
Yes.
People, because they've had many cases of people even falling from the construction site and they end up losing their lives. And I doubt if many of them had this knowledge that there's a body which has been set and actually can come in such situations. Why do you think many people are not really aware of this institution?
That's an excellent question. First, I'll answer you the first part of your question. Since when has this institution existed? This institution has actually existed in one form or another from 1948.
And it used to have the same name, or it's the one that you're talking about?
So what happened is, for those who did history, they remember we were a colony of the British. And the same activities that were happening in Britain, if you enjoyed your history, you remember that there was something called the Industrial Revolution. That Industrial Revolution led to a lot of injuries and deaths in the industries.
Yes.
And at the same time, there was also a lot of mining activity in the UK then. And you remember that some of the biggest mines were the coal mines and all the other mines, because energy then was derived from coal. And it was noticed also that there were a lot of workers who would get chest problems, respiratory problems from the coal mines. Those were, if you read a bit, you coal workers' lung disease. And that led the UK to enact legislations that would protect these workers. And obviously, being a colony of the United Kingdom, then the colonies also, there were colonial interventions in the colonies to echo what was happening back home, because we are also getting to the point where we are getting the nascent industries then. And this is actually what led to the initial colonial ordinance on factories, and then thereafter what we called the Factories Act, which I think was enacted and then was repealed again carried us through independence up to about 1990, when we had a review of legislation which called it now the Factories and Act, which carried the occupational safety and health message from the factories into other places of work, and in 2007 substantively actually called it the Occupational Safety and Health Act, so that it is an act that does not domicile itself only in the factories, but domicile itself in all spheres of work.
Okay.
You're a journalist, there are very unique work circumstances that you're going to have. Recently, you have also been declared a frontline worker. Those are significant things, because it actually recognizes the risks that you have from an occupational standpoint. So that actually brings everybody into the ambit of this legislation, and therefore you are able to be protected when you are working. And in the event you get an occupational issue, it's addressable within the confines of the
Very well. Talking of protection, I know the question that everyone that is watching us would be asking is that now if I get hurt in my line of duty and now I want to seek your help, or I want you guys to come in to help me, first of all, how does one get to be part of this body? Because is it something that everybody can just walk in and say, I want you guys to have me in your system so that when I get hurt in my place of work, then you'll be able to come in for me? what are the processes, how somebody can be part of the team?
Okay, that's an excellent question. First, the Directorate of Occupational Safety and Health is a government department. It's a government department, like I said, that is domiciled in the Department for Labor, in the Ministry of Labor and Social Protection. So it's a government department, and therefore, the member is a member. It's not an exclusive club. The membership is that you are a worker across any industry. And in the event there are any issues that arise relating to that, I mean, you have access to our offices. We have 29 offices across in 29 counties, but we are actually represented in all counties. You may find some counties, the offices may be domiciled in Nakuru, but they are responsible for other offices. May be domiciled in Eldoret, but responsible for other offices. So we are actually across the country. So
Thank you very much, guys. I believe you have learned something out of that discussion that we have had with Dr. Nyandusi. He was taking us through about giving us all the information as far as Directorate of Occupational Safety and Health Services is concerned. We have managed to ask him questions, and actually has answered them in a very beautiful way. So I know those who are watching us from home, you have gotten something to carry home. Now, on the second part of the interview, we will be bringing in, like I told you, as we are beginning the show, that we're having two gentlemen. And right now, we are, as we end this part of the first round, we're just taking a short break, and when we return, we'll be coming in with another gentleman who is going by the name Andrew Muruka, who also will still be expounding more on what Nyandusi was talking to us about. But I know he's going to be answering also some of the questions that probably Dr. Nyandusi did not answer. So stay tuned, and we're just taking a short break and coming back shortly. Keep watching Lolwe TV. Welcome back, guys. Remember, this is a Business Tuesday, and this is the second part of the interview. Remember, on the first one, we told you that we will be bringing in another colleague on the interview also, and his name is Andrew Muruka. So he will also be talking about expounding more on what Dr. Nyandusi already talked about, and he's also called actually Dr. Andrew Muruka. So we are talking with two doctors here. If probably you're just joining us in this second part of the interview, today we are talking about Directorate of Occupational Safety and Health Services. That is what has been making part of our interview, because I know there could be people that are just tuning in right now. We have had the first round of the interview, and now this is the second one, and this is a Business Tuesday as usual. My name is Mursowino, and this is a Lolwe TV. Welcome to the program once more. Karibu sana, Daktari.
Thank you, Maurice.
Yes. How is the going?
The going is fine. We are trying to struggle to survive during this pandemic. Yeah.
Very well. You know, we talked with your colleague, and actually what he did was more of just an introduction to what the body does. So you tell us, all the viewer, a few things maybe you feel they would love to know about what this body deals with.
Thank you very much, Maurice, and listeners to Lolwe TV. We are very grateful, and we are very happy to be with you and to engage your listeners about the Directorate of Occupational Safety and Health Services. As you have been told, we are a department in the State Department for Labor. And we undertake lots of activities some under the Occupational Safety and Health Act, which now your listeners are very much aware of, and also under the Work Injury Benefits Act. So there are two laws that the Directorate of Occupational Safety and Health implements. And right now I would like to talk about the Work Injury Benefits Act.
Yeah, very well.
Yeah, because I know that it's very critical in terms of awareness creation to members of the public and even the society at large, and all the workers of the country. This is one of the laws that was promulgated during 2007, and it came to force in 2008 by way of notice in the Kenya Gazette. Now, the Work Injury Benefits Act main purpose is to put in place measures for compensation of workers and employees who get injured in the course of employment. Yeah, or in the line of duty. So in the course of employment or in the line of duty. So if you are sent to town, for example, and you are a salesman, you are sent to any place, and you get injured in the process or in the course of carrying out your business, then that would be considered as an occupational compensable disease. So those type and categories of employees will fall under the list that can be that can be compensated under the Work Injury Benefits Act. Yeah. The other thing I want to say about the Work Injury Benefits Act administration in Kenya is that there are exclusions. There are certain times when you may not be compensated. Such time is when you don't report. If you are injured in the course of employment and you don't report this injury to your supervisor, the law says that you cannot be compensated. And if that non-reporting goes for 12 months, then you will not be compensable. Number two situation which can force an employee or a person not to be compensable is when they refuse to attend a work injury evaluation. You can be asked, you can allege that you got injured in the course of employment, and you may have suffered some percent disability. But if you are asked now by the director of work injury benefits to come for work injury evaluation clinic, and you refuse to attend, then whatever your claim is will be null and void.
What if, sorry for cutting you short,
yes,
what if this person that we are talking about that got injured in the line of work,
yes,
the injuries are so extensive, probably lost his arms, do you think this person can be in a position to attend to that kind of invitation? What do you do in such cases?
Yes, that's a very good question. If you suffer extensive disability as a result of a work-related injury, the employer is still required to ensure that you access a work injury evaluation clinic. So the employer will meet that cost of bringing you to the work injury evaluation clinic, because he's under obligation to ensure that you are compensated. And he is the one actually to compensate. He or she is the one to compensate. So he's supposed to ensure that he conveys you. Conveyance is part and parcel of work injury benefit. Conveyance to hospital, conveyance to the work injury evaluation clinic. Yes.
Again, what every Kenyan would love to know, talking of compensation, to what level? For example, again, probably somebody fell from a construction site and he happened to lose again a leg or something like that. Now you are compensating to what level? What exactly is your contribution towards the services that probably are going to help this person recover?
Maybe just come again so that we get it clearly. Are you asking about the maximum compensation?
Yes, yes.
Due?
Yes.
Of course, the maximum compensation is for 100% total disability. 100% total disability like this. Number one is death. If you die in the course of employment, then the total permanent disability will be 100%. Now, if you suffer from total paralysis, you got involved, maybe you fell from height and you suffered 100% or what we call total paralysis. And therefore, anything that normal human beings do on a daily basis, somebody has to help you to do. Like somebody has to help you to wash yourself, somebody has to help you to eat. Then if it is declared that that is 100% paralysis, if you are paralyzed, completely paralyzed, that will be 100% total disability. So in that case also, you will be paid 100% total permanent disability.
Yeah, so I was asking you, when somebody dies and he has left behind a family, your compensation means, you know, this person who has died, of course, was the breadwinner. What exactly are you bringing on board? Are you going to give some money to the wife and the children, or are you going to educate the children? What is it exactly? Or you are just going to maybe do the bill for the hospital and all such kind of stuff?
And that's a very important question, Maurice. And I think we need to understand it very, very well. First, we need to understand that the employer is the one that compensates. The Directorate of Occupational Safety and Health's main role is to enforce the Work Injury Benefits Act. We administer that act to ensure employers compensate those who get injured in the workplaces or in the course of employment. So that is one aspect of clarification. And the employer is the one that will compensate.
The employer.
So for us here, the main thing that we do is to use the government system to identify the actual dependents of this employee. And we use the Ministry of Interior and National Government and Coordination of National Government officers, particularly the National Government Administration officers, the DCC in particular. The DCC is the sub-county, in the national government, we have what we used to call the provincial administration system. So in that system, we have officers up to the chief, who help, up to the assistant chief actually, who helps the directorate to identify the actual dependents. Once we identify these actual dependents, we go ahead and calculate the amount of compensation due to the person who got injured. And based on the percent dependency, we distribute that amount, the whole of it, amongst the identified dependents. Yes.
Very well. Now we are bringing the show to an end. Your last word to the viewer at home.
My last word is the current concern about the coronavirus, SARS-CoV-2, and COVID-19 as a compensable disease. This is a question that I've been asked many times, and I want to clarify here that COVID-19 is a disease caused by a virus. There are so many diseases that are caused by viruses, which are occupational diseases. COVID-19 is one of them. The only reason and the only things that must be determined are that somebody got COVID-19 or contracted COVID-19 in the course of employment or during work. If those two can be established, this person is our employee, this person got COVID-19 in the course of employment, then for that particular purpose, COVID-19 will be an occupational disease. I know there are several arguments against this, but this is the truth. COVID-19 is an occupational disease if you contract it in the course of employment or during work.
But I know it will be very hard to tell. Somebody might say he contracted it along the way from work to home. And you know, people go to so many places even after work. So that would be a topic of discussion, because it would be very hard to tell where somebody contracted COVID-19. But we leave it there for now. I know we'll be calling you again so that you can shed more light on this, because this is just the beginning of these long interviews, kind of a series that we will be running. But I will be calling upon you in case we have questions from our audiences. I will be coming upon you so that you can explain more, especially touching on COVID, because still COVID is a new disease that people still have very little knowledge about. And as time progresses, I know people will be getting maybe to know much about it. So thank you very much for finding time to speak to us on Lolwe Television Network. This is Business Tuesday. We are very happy to host you today. And just like I said, I know when we call upon you again, you will show up and help us explain to all the Kenyans some of the questions that they might be having. So that marks the end of the interview today, guys. Remember, that was Business Tuesday as usual, the program that comes to you every Tuesday, 8 p.m. on Lolwe Television Network. My name is Maurice Owino. Keep watching Lolwe TV.